Pectoralis minor syndrome, often abbreviated as PMS, is a condition where the nerves and blood vessels under the pectoralis minor muscle become compressed. This muscle is located beneath your chest, attaching from the ribs to the coracoid process of the scapula. When PMS occurs, it can cause a range of symptoms that mimic other upper extremity pain syndromes, such as pain in the shoulder, neck, chest, and arm, as well as numbness, tingling, and weakness in the arm and hand. PMS is closely related to thoracic outlet syndrome (TOS), but the compression in PMS specifically happens beneath the pectoralis minor muscle. Understanding this distinction is crucial, as the symptoms can often be confused with other conditions, making diagnosis challenging. Recognizing the unique features of PMS helps guide proper treatment and management. Causes of pectoralis minor syndrome are diverse. Repetitive activities, such as certain sports like swimming, baseball, or rowing, and occupations that require frequent overhead arm movements, can stretch and strain the pectoralis minor muscle. Acute trauma such as car accidents or whiplash injuries can also trigger PMS. Poor posture, especially from prolonged desk work or excessive mobile phone use, is increasingly recognized as a contributing factor. Symptoms typically include pain in the neck, chest, shoulder, and arm, as well as numbness, tingling, and weakness in the hand. In some cases, swelling, coldness, or discoloration of the arm may occur, especially if blood vessels are compressed. Because these symptoms overlap with other conditions, a detailed history and physical examination are essential for accurate diagnosis. Diagnosing PMS requires a careful approach. Doctors start with a thorough patient history, focusing on daily activities, occupation, and any history of trauma. Physical examination includes palpation of the pectoral region and special tests like the upper extremity tension test and the Ruse test, which provoke symptoms by stressing the affected area. Imaging studies such as X-rays, MRI, and ultrasound can help rule out other causes and visualize the compression. Electrophysiological tests may be used to assess nerve function, though they are often normal in PMS. A key diagnostic tool is the pectoralis minor muscle block, where a local anesthetic is injected into the muscle. Significant symptom relief confirms the diagnosis. These steps help distinguish PMS from similar conditions like cervical radiculopathy or subacromial impingement syndrome. Treatment for pectoralis minor syndrome usually begins with conservative methods. Activity modification and posture correction are key, especially for those whose symptoms are related to repetitive movements or poor ergonomics. Physical therapy focuses on stretching the pectoralis minor muscle, strengthening shoulder stabilizers, and improving posture. Home-based exercise programs such as doorway stretches are often recommended. In some cases, local anesthetic or botulinum toxin injections may be used to relieve muscle spasm and pain. If conservative measures fail and symptoms persist, surgical interventions such as pectoralis minor tenotomy may be considered. Early diagnosis and tailored treatment plans are essential for optimal recovery and preventing long-term complications. Pectoralis minor syndrome is a frequently overlooked cause of upper extremity pain and neurological symptoms. Its clinical presentation often mimics other conditions, making careful diagnosis essential. Most patients respond well to conservative treatments, including physical therapy and activity modification. Recognizing the signs and understanding the diagnostic process can help ensure timely and effective management. In rare cases where conservative measures are not enough, surgical options are available. By staying informed about PMS, both patients and healthcare providers can work together to achieve the best outcomes and restore quality of life.